All right, so we have been looking at these topics, and we do think that they're all important, none getting priority over the other.
hmm
First week when we did the cooking class, that was really beautiful. Donna, were you able to participate in the virtual cooking class?
Yes, I was on there. Yes, yeah,
Great job, great. And
yeah.
then 2 weeks ago, we looked at diabetes, and last week we looked at cancer. So this week, I'll be looking at hypertension.
hmm
What I must say is that these three conditions are so prevalent in our society. They need attention. People need to be aware. Information needs to be passed on so that people can actually, learn and adopt and increase knowledge. So for today, for hypertension, I'm going to look at a little bit of Canada's intention on this topic. So Hypertension Canada is just an agency, and it is the only Canadian organization dedicated solely to the prevention and the control of hypertension, or high blood pressure as we know it, and its complications. So what Hypertension Canada actually do, they look at they partner with stakeholders to look at advanced research on high blood pressure, and also advocate for education amongst the public and the healthcare professionals to ensure that Canadians avoid the potentially deadly complications of high blood pressure. Now, there is a link, Amari. I'm not sure. I will try to share it with you further on into the presentation, but I'll look at a little bit of statistics. It says that the global prevalence of uncontrolled hypertension, no, not just hypertension in general, but the uncontrolled status, the prevalence of that has slightly decreased, which is good news, I would say, in this decade. So, or I would say the previous decade, up to 2019, there was 26%, and it came down from 2010 by 3%. So in 2010, there were 29% of uncontrolled hypertension prevalence in our society, and that came down by 26% in 2019. I must say, though, that it has not yet reached its voluntary or global target. The target for hypertension or uncontrolled hypertension is really 21%. So we're 5% out. The World Health Organization has been mentioning the high intake of salt, or sodium, as we would call it. It highlights that reducing sodium or salt intake and also increasing your potassium will not only lower the blood pressure, but prevent cardiovascular accidents and cardiovascular events. We know too well that hypertension is linked directly to cardiovascular accident, which is stroke, and also to aneurysms and so forth. The report emphasizes that substituting sodium with potassium enriched salt is a more affordable strategy and a more beneficial strategy. World Health Organization continued to look at hypertension in a very large way, and it is said that for every 1 gram, and I will tell you what 1 gram is in a moment, for every 1 gram of salt that we intake, it raises our systolic, which is the top number when our heart contracts, by 2.11 milligram. Now, let me break down the science. So we often hear that we need our blood pressure to be 120/80 or below. Well, when we mention the 120, which is the top number, it is referred to as the systolic number, and that is when the heart is contracting and pumping the blood out to the rest of the body. Now, the diastolic, with each contraction of the heart, it relaxes. The diastolic refers to that episode where it relaxes, and that number we need it to be 80. Now, for each gram of salt that is intake into the body, we increase that systolic number in particular by 2.1. It can also increase the diastolic, but for facts right now, it increases it by 2.1 milligram. So that's 1 gram. Let's say we take 5 grams of salt, which is the daily requirement. The daily requirement, 5 grams of salt equal 1 teaspoon. 1 teaspoon of salt throughout the day for all meals. That would increase our systolic blood pressure, which is the top number, by about 10 or 11 milligrams of mercury, which is the measurement unit for blood pressure. So we can see why choosing particular salt would be more beneficial to our blood pressure. We often speak of Himalayan salt and Celtic salt, as opposed to many other salts that are used in our daily food and preparation. It is said that the Himalayan salt actually has, and I will find that exact information so that I am not doing it from memory. It is said that Himalayan salt, all salts consist of sodium chloride. Himalayan salt, on one hand, has 2,200 milligrams of sodium in comparison to other salts like sea salt, which contains 2,300 milligrams of sodium. So on one hand, yes, we can take sea salt. On the other hand, it's more beneficial to use Himalayan salt because it has less sodium and is least likely to raise our blood pressure. Now, what is hypertension? I mentioned previously about the blood going out to the body, and the heart is the main engine that pushes that blood out. And what the heart pushes the blood out through would be arteries, right? So when the volume of blood that hits those arteries to the organs, that's what is referred to as the blood pressure. Now, the higher the blood pressure is, the more effort the heart has to take in order to get that blood out. The more narrow the organs are, the more narrow the vessels are, rather the arteries are, it's the more difficult it is for the heart. The more water in our system is, the more difficult it is as well for the heart to pump that amount of blood. Now, you heard me mention water. Water is critical for the body, and so too is salt. Salt or sodium chloride. We are not saying do not take any salt in your system. No, there is a required amount on a daily basis that we should follow. If we go beyond that, we are predisposing ourselves to heart conditions, cardiovascular conditions. Why does the body need salt? Salt is an important component of blood and other body fluids, including our tears, our sweat, semen, and our urine. Our body uses the salt to help to retain water. Water is only balanced in the body because salt is also in the body. It prevents dehydration, which lowers our blood pressure and can lead to death. Don't get me wrong. Yes, salt does this. If we take in the right amount of salt and it does its function with water and it nourishes the body and hydrates the body, it will lower the blood pressure. But on the other hand, when we take in too much salt, it's going to retain too much water, and that's where the problem comes in. When the kidneys are ready to excrete, because you have to get rid of all the waste from the body, sodium becomes a waste and excessive water becomes a waste. Now you put pressure on the kidneys to get rid of that water. If there is too little bit of salt in the blood, what happens? We develop what is called hyponatremia, and this is a medical term, or we say low salt. There are symptoms and signs such as nausea, vomiting, headache, confusion, and I have seen where patients in the hospital would have had a seizure, and when the doctor, goes through the lab results, one of the key findings would be their sodium value, and the sodium would often be too low. If your sodium is too low, it can lead to seizure. It can lead to confusion, drowsiness, fatigue, loss of energy, restlessness, irritability, not to mention the weakness in our muscles and the spasms and cramps in our muscles. And I did mention coma, or I did not. Coma is a part too. Once you get confusion, seizure, lethargy, loss of energy, that leads to coma. So looking at it, you see that sodium is absolutely important, but it is with the intake that the trouble comes. Now, I want to break down for us, I mentioned previously the readings for the blood pressure, the systolic, which is the upper number, and the diastolic, which is the lower number. So when the heart beats and when the heart relaxes, the normal reading that everyone would want, but not all of us have it, about 40% of us don't, is under 120 for the systolic and under 100 and under 80 for the diastolic. Now, once we go over 120 for the systolic to 139, it is referred to as pre-hypertension. For diastolic, once it goes over 80 to 89, it's referred to as pre-hypertension. Now, hypertension is diagnosed in stages. There's stage 1 hypertension when the systolic gets to 140 to 159. So almost like a 20 millimeter of mercury difference or range. And when the diastolic ranges from 90 to 99, but it can get higher. I've seen it, and it is very concerning. Hypertension stage 2 is when the systolic is above 160 and the diastolic is above 100. And we go into a crisis when we find a patient or an individual with a number of a systolic above 180 and a diastolic of 110. That requires immediate intervention. And usually these interventions are pharmacological, which helps with this acute need. You need to get the blood pressure down right away. There's no other factor that will help you to get it down than some good pharmacological measure at that point. What are some of the symptoms of hypertension? Before I get to the symptoms, let me just finish with salt intake. It is said that around the world, the country with the highest daily salt consumption per capita, would you be able to guess? Anyone is brave enough to guess? No? All right.
The United States?
I would say so too, but think about when we go out, and not to bash or not to deny any restaurant of such with their food and their business, but China.
Oh.
Have you ever eaten your Chinese food, and man, you can pick the sodium out of it. You can literally go like this and pick the sodium and put it aside and eat the rest of the food.
Oh my.
Yes. So China is 17.7. Remember when we spoke of the grams and we said we don't want more than 5 grams of sodium in our diet for the whole day? They have 17.7 grams. Huh. All the, what you call that, soya sauce. And that is why we recommend Bragg's amino, which is a better option than soya sauce, or our good old molasses, Exactly. Hungary is followed with 14.3%. And yes, interestingly, those countries, Slovenia, Romania, Serbia, Bulgaria, Croatia, Slovakia, all rank very high on the list. But where do we come? Where does Canada fall? Where is North America? So the United States sits roughly in the middle of the pack with about 8.9 grams per capita. So United States is above by 89% pretty much. 89%, so they're above by 39% because they're over the 5 grams per capita per day. Similarly, Canada is little bit higher than the United States at 9.1. The United Kingdom is behind Canada at 7.1, and so forth and so on. All right. What are some of the symptoms of hypertension? We often hear that hypertension is a silent killer. And yes, it is. Oftentimes, when we end up finding out or someone finds out that they're hypertensive and receives a diagnosis, it is long gone. It was happening because it's a chronic condition. It was taking place in our system before it is revealed, right? So, with that said, how can we contain this? What can we do? We can be proactive. Proactive meaning get your blood pressure tested. Every household should at least have a device to do the blood pressure. You know, we had left ours back in Jamaica and we decided we need one, you know. Ian is an older man. He didn't hear that. And I am getting older. So we need a machine to help us to have an idea of what the blood pressure is. And not to mention the kids. The kids who are also developing hypertension, they need to be monitored as well. So you don't have to get an Amron brand. Amron is an excellent brand worldwide, but there are many other brands, and some of them are a little more affordable than others. Some are a little more expensive. What are some of the symptoms of high blood pressure? So headache is one of the common ones, and sometimes it's like in the back of the head. Shortness of breath, and we can relate shortness of breath with a symptom of hypertension because we spoke of the water and how it's balanced with the sodium. And if there's too much water in the system, remember all the blood that goes to the heart has to pass through what we call the pulmonary system, which is the lungs. Can you imagine all that fluid backing up in your lungs? Yes, that's why we get that shortness of breath. A nosebleed. It's not always connected, but it can have a connection. The symptoms are not always specific. When do we see a doctor? We need to see a doctor once we turn age 18, and especially if we're over the age of 40 and we have a high risk of high blood pressure, like a first-degree relative or our lifestyle depicts that, you know, you're at risk. You're sedentary, you're not exercising enough, not enough physical activity, you're eating diets with high levels of sodium in it, and so forth. What are some of the causes of high blood pressure? Blood pressure is determined by two things, and I mentioned them previously. The amount of blood the heart pumps and how hard it is for the blood to move through the arteries. We would have learned of a condition called, I often get a tongue twister with this condition, but I'll try. Atherosclerosis, you would have heard of that, where there is fat and there is thickening of the walls of the artery, and this leads to narrowing, which is another condition called arteriosclerosis. So with those thickening and narrowing, the heart will require more effort in order to pump this blood, which leads to high blood pressure. There are other causes. So you can have primary high blood pressure and you can have secondary high blood pressure. Primary high blood pressure it's just developed gradually over many years, like the blood pressure I was describing previously. But you can also have a secondary high blood pressure, which secondary means it's linked to something else. It could be an underlying condition, and it tends to be more like adrenal, things with the kidney, diseases happening in the kidneys, like adrenal tumors. Adrenal is a section of the kidney. It's on top of the kidneys, and they play a vital function in regulating our salt or sodium as well, our blood pressure. And if you have a tumor, then it can also trigger secondary hypertension. And that is why if you have had an experience with anyone who would have had been diagnosed with high blood pressure, a part of the testing that is used is what we call a 24-hour urine collection. And out of that urine collection, they actually test what we call the vanille mandelic acid, which is referred to as a VMA. And based on the level of that, you can be diagnosed as well with hypertension. And that is produced in the adrenal gland. It can also be as a result of heart conditions that are congenital from birth. Cough medicines, cold medicines, pain relievers, even birth control can trigger secondary hypertension, not to mention illicit drugs such as cocaine and amphetamines and stuff like that, that drug users often abuse. Obstructive sleep apnea could also be a causative factor for secondary hypertension and thyroid problems. Now, what are the risk factors? The risk factors include, some are modifiable. When we speak of risk factors, we speak of them as modifiable or non-modifiable. So the modifiable ones would be those that we can make a difference with what we do, our decisions. Those would be our lifestyle factors. But there are non-modifiable factors that naturally put us at some form of risk in different degrees, such as our age. The risk of high blood pressure increases with age. Until about age 64, the high blood pressure is more common in men. Women are more likely to develop high blood pressure after 65. As it relates to race, high blood pressure is particularly common among Black people. It develops at an earlier age in Black people than it does in white people. Family history, you're more likely to develop high blood pressure if you have one parent or a parent or a sibling with the condition. We mentioned about the high risk earlier and having a first-degree relative. Obesity or being overweight is another big risk factor for developing hypertension. Lack of exercise, not exercising. So when we don't exercise, when we don't exercise, we gain weight, we don't get our blood circulating properly around the body, and this can lead to sluggish blood flow and more pressure on the heart. Tobacco use or even vaping can raise the blood pressure in a very short while. Smoking injures we wonder how that happened. It injures the blood vessel lining and cause them to leak. And this leaking and hardening can cause the heart to have more difficulty in pushing the blood through. Too much salt, we mentioned that. Low potassium levels. You often hear that our potassium level needs to be right. It is critical for our heart to beat and to function. The foods that we often get our potassium from would be like potato and our yellow foods. Our yellow foods like papaya, oranges, bananas. Those are our high potassium food. So drinking too much alcohol is another problem, but we don't recommend alcohol in any amount at all. No, there's no good use of any amount of alcohol. Stress is another very potent factor that contributes to hypertension. And whatever stress-related habits that we have and can consider changing, that would be very beneficial. Other chronic conditions I mentioned, kidney diseases, sleep apnea, diabetes. And sometimes in pregnancy too, you can have high blood pressure. Now, what are some of the complications of hypertension? We mentioned it previously, heart attack or stroke, which results from hardening and thickening of the arteries due to high blood pressure or other factors that can lead to heart attack and stroke or other complications. Aneurysm. Aneurysm is where the blood vessel comes under so much pressure, the artery, and it bursts. It can happen in the brain, most common brain, and in the just above the abdomen where you have the aorta. So the aorta is that main artery that takes the blood from the heart to the body. And if that artery bursts, it is, I think there was one person who I met that survived aortic aneurysm. I've had my own uncle at the age of 37. He was just getting up, you know, out of bed to get to work, and he went to the bathroom, and he never made it out. He literally had a brain aneurysm right there at the age of 37. Very wonderful young man. He was an elder in the Seventh-day Adventist Church, a youth elder, very peaceful, loving person. And he was taken from us in 2015 from brain aneurysm. Heart failure is another complication. Kidney problems, eye problems, dementia is another link to hypertension and the complication. I'm just seeing what else I need to mention to you about. All right. You know, we go to the doctor sometimes or we do our blood pressure at home and it is very high. Sometimes too, we go to the doctor and it's very high. It can be vice versa. It says that blood pressure measurements that are higher at your home than at your healthcare provider's office could be caused by an error in measuring the blood pressure at home. It might also be due to a decrease in your stress level at the provider's office, which kind of in my mind, I'm saying stress level reduce at the provider's office. I think perhaps if you have a great relationship with your healthcare provider, with your physician, this could be the case. But in truth and in fact, if it's an initial visit, uncertain, there's no relationship, that stress level might be higher. In any case, if there is a variation, a vast variation in the readings that you obtain at home and at the doctor's office, it can be referred to as a mask reading. Whether it's hypertensive or whatever the result is, it's a mask reading, and it does happen. Does blood pressure really have like a pattern? Some people say they have noticed their blood pressure is lower in the morning or in the afternoon or so forth. It does not necessarily have a pattern. However, usually blood pressure starts off, it raises just a few hours before we wake up in the morning, and it continues to rise during the day. It peaks at around midday. Hence, you would say, okay, that is why they give hypertensive medications in antihypertensive medications in the mornings. Yes, that's usually one of the cases. That's usually one of the cases why. We have seen where it's given in the afternoon too, or in the evening time, or at nighttime, because there are persons with a different pattern of readings, high blood pressure readings. Some persons tend to drop in the late afternoon, their blood pressure tend to drop. But on a normal basis, the blood pressure gradually rises as we get up in the morning and start our activities and our daily life. And in the afternoon, it peaks, and then it should go down later on in the day. Okay, I don't want to bombard you. It's half an hour there. We're going to look at a few things that we can do to all right, we're going to look at how we diagnose high blood pressure. So to diagnose high blood pressure, your healthcare provider examines you, and they will ask you a number of questions like your medical history and any symptoms that you're having. Mark you might not have symptoms. Your provider listens to your heart and using a device called a stethoscope and using a blood pressure machine. And your blood pressure is checked with using a cuff around the arm, we know that, and we inflate it, and from that reading, from that process, we get a reading. Now, usually, in order to diagnose hypertension, you would need to get a historical readings. So like 3 mornings at the same time, you had enough rest, you didn't eat too late and so forth. So the condition of your body would be kind of in a homeostasis state. That's how the doctor would recommend you do the blood pressure for the readings to be used towards diagnosis. Alternative medicine, when we look at treatment, weigh heavily on diet and exercise. So diet and exercise. So diet and exercise are best ways to lower blood pressure. But there are some supplements that are promoted as heart healthy. And these supplements, and the first one I'll mention is fiber. Fiber, such as psyllium and wheat bran. So when we recommend that, we use products that contain like wheat germ, there's a reason behind it. These actually help to lower our cholesterol, clean our arteries, and help to lower blood pressure, help to clean the system, detox the system, which in turn has less stress on the kidneys and on the heart. Minerals such as magnesium, calcium, and potassium. We mentioned previously about sodium, the importance of that, and potassium, the importance of potassium for the heart and the heart muscles. Now, when an individual goes to the doctor, has concerns, or doing a routine checkup, which we recommend, the doctor will do these tests, test your magnesium, your minerals, your calcium, and your potassium, so that they can understand what's taking place in your body. Is there a deficiency? Is there too much of any of these minerals? Your folic acid level too is critical. And from your yellow foods I mentioned earlier, you get your potassium, you also get your folic acid from those. Omega-3 is another alternative that will help with, I'm hearing some thunder outside. It's very strange hearing thunder in Canada. But yes, we've been having rainy season. So omega-3 fatty acids found in fatty fish, we're not denouncing the consumption of fish, but we are recommending that closer to a vegan diet that you are is better for you. But still, science has proven that like salmon has very high omega-3 fatty acid in it, and it's great for brain health, heart health. But I must say to you that a good supplement to that is help me, flaxseed. Flaxseed, the same, you get your omega-3. So when we do our smoothies, when we do our salad, when we're baking, we put our flaxseed in and we can reap the benefit of our omega-3 fatty acids, which will help with the hygiene of our arteries, which will in turn help with the heart and its effort and its relaxation. What are some of the other things that we can do? What are some of the effort that we can put in place, some of the decisions that we can make or take in order to help to reduce hypertension? Don't smoke. Tobacco, as I said, injures the wall of the blood vessels and speed up the process of hardening of the arteries as they become stenosed and callous. Maintain a healthy weight, and this happens over time. It's not far-fetched, but it's a timely process. It's a process that requires patience, commitment, but it is doable. Recently, I was exploring, there's an app that I have downloaded on my phone, and I see where they're trying to approach health, physical health from many different angles. One of the things that I looked at was the fasting. We tend to eat and we eat right around the clock, which should not be. Your body requires eating at set time and resting. And there was one fasting that they mentioned that I've said, could I do that? And it was like 18 hours of fasting to 6 hours duration of meals. So the clock, there's 24 hours in the day, 18 hours of not eating and 6 hours of eating. So I was trying to navigate it and say, okay, so let's say I begin to eat at 9 a.m. So I have 6 hours, 9 to 3 p.m. that I can eat. And the rest of that time, I can't eat. After 3 p.m. straight back to 8:59 a.m. I said, it's not too bad, because if I eat breakfast in the morning, it would give me 4 to 6 hours that my food would have digested. I would have now been hungry and I can eat again. How much I eat it depends again on how much, because if you eat too much, then it's gonna store as fat, and it denounces the whole effort that you're putting in. So you would have to have a set amount of calories that you want to take in. And then they also have a 16 to 8. So you eat for 8 hours, that duration. And then 16 hours you fast, and so forth. So those are some of the things we can consider, but these are all through the guidance of your medical professional, because this lesson or this presentation is just merely for introducing you to make you more aware, so you can have open dialogue with your healthcare provider. Get more exercise, and we should get no less than 150 minutes of moderate aerobic activity. Go out there and get the heart pumping, get sweating, whether through cycling, walking, swimming, whatever it is, gardening, get going, do something. Practice good sleep habit. Poor sleep may increase the risk of heart disease and other chronic conditions. Adults should aim to get about 7 to 9 hours of sleep daily, and kids get more. Like kids, for me, they should get 11 hours to 13 hours of sleep. Yes, cost it what it will. If you have trouble sleeping, talk to your provider about strategies that might help to sleep. Manage your stress. Find ways to help to reduce emotional stress by speaking about, life challenges. Find partners that are supportive, your circle of influence. Be mindful who you put in your circle of influence, because it can have a negative effect on your mind. Think positive, think positively. Instead of thinking negative, I can't, say I can. However, what do you need to put in place to make it possible? Kind of retrain your mind and rewire your brain and develop these neuronal pathways that will help us to be positive and get through life better. Try slow, deep breathing. And this one is so wonderful, and doesn't have to be yoga. You can just do it by yourself. You take, let's say, 6 deep breaths in, count to 4 while you're taking it in, hold it for 4, and breathe out for 4. And you repeat that cycle, and that helps us to relax. Like if I'm rushing and I have something, to do that's important, this is one of the techniques that I've tried. I've tried to literally stop breathing for a moment, get my heart to a level that it doesn't feel like it's pounding out of my chest, and then get my breathing back to normality. And then it will give me a less anxious feeling. You can try that too. Eating healthily is, we can't mention that anymore. We have to make better choices in what we eat, how we eat, when we eat, and I will say where we eat. Exactly. Use less salt. How do we use less salt? We can use less salt by having less processed meats. No, one would say, okay, but the vegan food or the foods that are healthier for us are sometimes processed and so forth. We can't get fresh vegetables. Like when I was back in Jamaica and I would go to Coronation Market on a Thursday morning, I missed that. Oh, the plantains were the best. The cabbage was the greatest. And not to mention, I won't let you drool about anything, but yes, we're going to avoid processed meats. We're going to avoid canned foods. However, I noticed that if you read the labels carefully, there are some that have less additives, less preservatives, and they will tell you. So I would read and I would go for those options. Commercial soups. And oh yes, these soup, I've had them. These soup are they're laced with sodium. You can tell by the smell of it and the taste of it. Frozen dinners as well have high level of salt. As I said again, we want to look for, read the labels and look for what's best for us. You'll see some reference that say a sodium intake of 1500 milligram. Yes, 1500 milligram, 5 grams, that's the equivalent or less is ideal for most adults. Limited alcohol. No, we don't say limited. We say no alcohol. And if you actually, if your doctor prescribes medications for you to help with your high blood pressure, please don't say, I'm not going to take it. Please don't be in denial. Have an open discussion, because denial is not going to help us. The medications are prescribed for a reason. And I would say a season, but the season is dependent upon you and your decision and your level of input. The outcome is only determined by our input. Our action will determine our inactions will determine our outcome as well, right? So we can't just say, oh no, I'm not going to take it. Hypertension will not go away just like that. It's an active process that helps to be reversed. But can it be reversed? Yes, it can. There are so many, like never before, different classes of medications that are used, or drugs that are used to treat high blood pressure. And you would wonder why so many classes. There needs to be, because there are different parts of the human body that only certain drugs will work for. There are certain stages of hypertension and certain underlying conditions that only certain drugs will work for. So it is not a one size fit all or a one approach fit all. It is an approach that is tailored for an individual. And that is why, from I've been growing up, they say, don't share your medications. And I am telling you, I get at rot when I hear of any family member say, oh, you know, I got this medication from, I'm like turning my eyes over, my head spinning. I'm like, what? Please don't do that. Yes. So at this time, I think that I've given you most of what I need to pertaining to treatment, prevention, and all of that. I will just ask you to, I'll just mention a couple tests more that the doctors will use to help to diagnose hypertension, or to see the status of your arteries or your cardiovascular status. A stress test is often used as well, where the patient or the individual goes on a machine, a treadmill, and they actually do a certain amount of time on the machine at a certain intensity, and that determines your heart rate. And from that, the doctor will know, okay, your heart rate is over an amount that is putting pressure. There's pressure exerting from the heart, and it is obvious because of the readings. They can do a stress test, lab test, as I said before, to test your minerals. That's another one. And an EKG is what I would like to mention, an ECG, just to tell the electrical activities of your heart. Because in order for our heart to pump, it requires electrical input. And for it to rest, it requires electrical input as well. So an EKG is paramount. Now, at this time, do you have any questions?
I don't, Naomi. You did very well. So much information. Thank you so much.
Thank you. Thank you so much. I appreciate that. Any
It's
questions?
amazing.
You're most welcome, Donna, anytime. Any question from you, Amari, Stacy?
No, not any question.
Okay, it was clear as a mud, they would say.
Clear as mud.
Clear as mud. There's so much information that's out there, and it can be overwhelming. And when I look at it, I said, oh my goodness, we really study hard as nurses, as doctors. You really study a whole lot. I said, did my brain contain any of this? No, I'm looking back at it, and it's like easy flow for me. But in nursing school, it wasn't like that, because you have so many conditions that you've never seen, never heard of, that you need to retain. But you know what? God is amazing, and He has placed in me a spirit of, I want you to know, because we can do better. And I believe I'm a living testimony, and that is why I am more confident in wanting to provide this information. And I do think too that giving the information helps me even more. oftentimes people run away from health ministry and health ministry duties. In the beginning, especially, I used it as a platform to just change my life. I'm like, the way we do things just not right. And I must say to you that just sow seeds. It's like sowing seeds to win souls for Christ. Sow seeds through health. In my household, I never pressured, particularly like my husband. I more pressure the kids because they're under influence. But my husband in particular, he's an adult. I will do, and he can observe. And also make resources available because I feel I have that obligation. And recently, it was just so heartwarming to hear Ian mentioned to me that, oh, I think that we should probably establish a vegan restaurant in Jamaica. I said, what? I said, am I hearing correctly? When you're overjoyed and you're overwhelmed, I'm like, this is true conviction. So we allow the information to go out and allow others to get convicted. While we polish ourselves, I'm still polishing. I had my daughter who asked me today for ice cream. I said, we have 3 vegan ice cream in the fridge. No, mommy, I need the, and I'm like, wow. But you know what? We're going to just continue to pray and continue to press them with information. Thank you so much.
Yep. So the only thing I have to say is that God made our bodies like a big battery.
Yes.
We're like a big battery. We're an electrical system.
Yes.
Our food needs to be electrical, and the part of an electrical system, especially batteries, just like a lead acid battery.
Yes.
We need the lead acid battery needs electrolytes to function properly.
Yes.
Salts and the fluids in our body they come together as the electrolytes.
Yes.
As the electricity to flow between the neurons in the brain and the other parts of the body. So
yes,
it's vital for us to have a balance, not too much water where the system is overloaded, and then there's enough electrolytes, because we can actually cause drowning of the cells. You have too much water in the system.
That's a beautiful scenario that you couldn't paint it any better, honestly. And like a battery, you have to continue to service it or it will die, and you have to put the right amount at the right time. And that's a perfect example, Omari. Never thought of that. Perfect example.
Yeah.
Yes. Thank you so much again, Donna. Thank you, Omari. And we hope this is our last session for this season period. Don't know how long from now, but one topic that came to mind, and it's as a result of a webinar that I attended online, and it was about mental wellness. It's a topic that just came about on the heels of COVID, and it's now like a multi-million-dollar industry because they recognize that one industry that grew during COVID was wellness.
Yeah.
And mental wellness is very important, and it's different from mental health. So hopefully sometime in the future, we might have a time to look at that. Thank you so much, and have yourselves a beautiful evening.
You too. Thank you.
Thanks, Naomi.
You're
Thank you so much.
You're welcome.
Have a good one.
You too. Bye.
All right. Bye.